So welcome to Wigan Borough CCG's annual general meeting of 2020. As you can see, this is a very different annual general meeting this week, and we are doing things virtually. There is got still a very packed agenda with videos and presentations from governing body members, and we're hoping to still get questions through the chat facility. Just to let those members of the public know that have joined the live event, there is a slight delay on us receiving your questions, but please do put them into the Q&A section of the chat, and then we'll make sure we respond to them. But if there is a slight delay, it's just due to the technical issues of the live event. So we are looking forward to hearing from members of the public, and are happy to ask any questions, and there'll be periodic times throughout the presentation for those questions to be answered. So as said, I'm Craig Harris. I'm the Accountable Officer and Managing Director for Wigan Borough CCG, and this is actually my second annual general meeting. I was only in post a couple of months last year, so very happy to be here. I'm sad we couldn't all be together, but due to the situation with COVID, unfortunately, we need to do things a bit differently this year, but I'm hoping it won't diminish the experience at all. So as you can see on the screen, our meeting agenda is in front of you. We're going to go through the governing body, then the CCG's duties, what we're proud of, and we could have probably filled a whole session with this, our finances, which will be led by Paul McKevitt, the CFO and Treasurer at the Council, working with partners, working with our residents, and then conclusion. So as I said, some of this will be presentations, some will be video, and there will be opportunities for questions, so please feel free to use the chat function. So I think now we're going to go to a video, and we're going to meet the governing body. Excellent. So that was an introduction to our governing body for those of you who haven't met all of the governing body. A superb little video, and that is why our comms and engagement team are outstanding. They've managed to pull together a fantastic set of videos and presentation for today. So I hope you enjoyed it as much as I did. Moving on to the next session, next section, sorry, meeting our duties. So our corporate objectives, very much in keeping with the deal 2030 that's part of Wigan Council and the offering Wigan, of which the CCG is a part of. So I'm not going to go through them in great detail, but there is an our part and your part, and there are 4 priorities here on the screen. So the first one is commissioning and health and care services, and that's about us commissioning services for all residents in the borough and to be delivering high quality and clinically viable as well as affordable services. Priority 2, equality and inclusion, and there couldn't be a more important time to ensure that our equality and inclusion agenda is at the highest priority in the organisation. So this is about everyone counts, and we truly believe that we want to have equitable access to health and care services across the borough, regardless of where you live or what you do. Priority 3, innovation and sustainability, something we're extremely proud of in Wigan, our innovation, but also our sustainability. And in relation to what we're going to do with regards to how we best use the Wigan pound, it's something that we talk about an awful lot and is really important to us. And linking from the Wigan pound, financial affordability, and this is about getting best use of the resources that are in the borough, but also bringing more money in. And Paul McKevitt later will talk a bit more about our financial duties. So in relation to the next slide, this is our CCG duties, and this is what we have. Provided health services in a way that promotes the NHS constitution, secured continuous improvement in the quality of services, worked with NHS England in improving the quality of our primary care services, and I think primary care has done a fantastic job over the last year, but especially a personal and a thanks on behalf of the governing body to our primary care colleagues for all of their energy and effort since COVID. We've promoted involvement of patients, their carer and representative decisions, enable patients to make choices about the services provided to them, and again, the engagement work we do is absolutely fantastic. Sought to reduce inequalities between patients. Unfortunately, some of the times we've seen recently have meant that inequalities gap has widened, and we've been doing everything over the past year, 1920, to address that, and we will continue to do so. Promoted innovation, research, education and training. Engaged with patients when devising its commissioning plans, and I think the locality plan as the single transformation plan for the borough is a real illustrative example of us engaging with patients in the design, the development and the co-production of that plan. Sought to provide health services in an integrated way, and the work we've done over the period with our integrated commissioning committee I think is demonstrable evidence of that, and exercise our functions effectively, efficiently and economically. So what we're most proud of. I think this is another set of videos, because if that's a photograph, I'll be absolutely horrified. So I'll hand over to the comms team, who will give you a little flavour of what we're most proud of from each of the directors. So over to you, Alexia, and others. Of the work we did in relation to developing a single transformation plan across the borough. So this was our opportunity to refresh our locality plan, and actually we went one stage further by developing the locality plan into a single transformation plan, pulling in reform, improvement and transformation across all age ranges, across all specialities in the borough, and developing this through our lens of a locality plan update. So as a part of our GM devolution response, but also in relation to the NHS long-term plan and the Wigan Deal 2030, which is the strategy in the borough led by the council for how we want to see services and the offer for our citizens and residents improve over that decade period. It was an excellent opportunity to engage, actively listen to residents, to people, to carers, to patients and to communities, as well as our providers across the public sector, our voluntary sector organisations and our key stakeholders in the borough. I'm also really proud of some other elements of work that as a CCG and a partnership responded to. We unfortunately had a major incident in relation to an IT failure with one of our main providers, and we really came together as a system to respond to that. And it would be remiss of me not to mention how we responded to COVID-19 from March onwards, and the excellent response we did in relation to getting our digital revolutionary offer up to speed with regards to GP practices, but also how, as we pull together as a set of partners in relation to our humanitarian offer and to support our people in the borough. So loads to be proud of. Hopefully that's just a little flavour of some of the key aspects, and we look forward to providing an update next year and describing further successes we've done with regards to our plans and delivering improved outcomes for our population.
My areas of responsibility span quite widely across the organisation, and I'm really proud of all my teams and their achievements. The quality team received their 5th consecutive high level of assurance for their provider quality monitoring from Mersey Internal Audit, which is unprecedented, and I'm particularly proud of them for that outstanding achievement. I think I must mention the Wigan Beaver Group and the antibiotic guardian learning experience. Hopefully those children will now be putting into practice what they learnt last year. So now thinking of safeguarding, the team worked with local authority colleagues to develop a comprehensive deal for our care leavers, which saw the CCG commit to funding for prescriptions for all our care leavers, so that was absolutely fabulous. The team also continued to commission and oversee what is regarded as gold standard health services for looked after children in Wigan. Moving through then to individualised care or continuing healthcare, the team worked tirelessly to reduce the backlog and continue to achieve the quality standards expected. The team were also involved in the ethical living framework, fostering great working relationships with both local authority and domiciliary care providers. As a consequence of this work, they were nominated for the UK National Go Awards for Public Sector Procurement and were highly commended award winners.
Hi, the Transformation and Commissioning team has had a really successful year in 1920. This was pre-COVID. We pulled together with all partners in Healthy Wigan Partnership the new locality plan that set out our vision and our achievements and what was our vision for going forward. We've done a lot of work in mental health, in implementing changes with the crisis team and in response to COVID, mental health hubs. We've also held the organisations together through the surge of the COVID phase 1. We've done a lot of redesign with our outpatients programme, and this has been vastly supported and changed at pace with a lot of virtual clinics, so there's less face-to-face, but diabetes, anti-coag and our eye services, a lot of change.
So the Primary Care Directorate is there to support primary care and to support them in improving quality and transformation. In the last 12 to 18 months, there's been a significant amount of work by the practices adapting and putting in a lot of IT to support them to do virtual consultation and triage, and to ensure that patients receive safe services. There has been so much work done by general practice in and around our care homes, keeping those patients safe and ensuring that they're well looked after, and that has involved many people within the primary care team. Flu is another area. There's been significant work done in the planning and then the implementation of the flu programme that has involved many people, and currently flu vaccines are being supplied and administered to patients across the borough in a safe manner.
Oh, right. Hello, everyone. And I'd just like to say what I'm proudest of my team achieved in the last year. And as a finance team, you'd expect me to say preparing the annual accounts would be our greatest achievement. But I think this year it's even more so because the team had to work virtually. For those of you who are non-accountants, to prepare the accounts, you're usually speaking to managers daily, working as a team, working closely in terms of constructing the accounts. But because we just started the accounts process just as lockdown started, we had to suddenly find a way to work virtually. So all the finance team had to find a different way of working. We were a traditional team that loved being in the office. We had to work remotely and put the accounts together. And two members of the team, there's a few members of the team are really new, only just arrived as we started that. So that was my biggest worry, although Ella and the team kept telling me we'd be fine, that we'd achieve this. And we did a great job. The auditors praised the standard of the working papers that we had, said that we were a model for others to follow in terms of what we did. So I thought that was a brilliant achievement, and it involved the whole finance team. There's a few people who put the finishing touches together, but it's one of those that if one part of the finance team doesn't get the information right, then we all fail. And it's one of those pieces of work that if you get it wrong, everyone's on your back, but if it goes right, people just take it as read. But they did a really good job, so I'm really proud of them for doing that. Well done, everyone. Thank you.
So there you saw a little insight into myself and the directors' moments of pride over the coming year. I appreciate some of those relate to a more immediate part of 2020, but I think it's important that although it is a look back on 1920, that you do hear about some of the achievements that sort of cut across the financial years. I know there's been some comments for those of you who are in the public gallery in the Q&A just with regards to the videos being slightly quiet. I think I was slightly quiet, and then we had a bit of a booming voice from Sally, and then slightly quiet again from Julie and Linda, and then another very loud Paul McKevitt. So we will try and make sure that when we put this available for watching after the AGM, that we sort out the volume issue. But hopefully you all got to hear most of the information and the elements we're most proud of. On that note, and talking to Mr. McKevitt, I'm going to hand over to him now, who's going to do the accounts for the years 2019 to 2020. Thank you, Paul.
Yeah, thanks, Craig. Good afternoon, everyone. So I don't know, hopefully I'm not too loud now. Hopefully you can hear me. As Craig says, we've been working virtually for a few months. So one of the key phrases has always said to me is you're on mute. So you always mute yourself. So if we start with the slides. So the first thing, the most important thing for the CCG is they achieve financial balance. So for a CCG, what you have to do is to just, you wouldn't think this is too hard, is to spend all your allocation, but you've got to spend that exact amount. So you've got to virtually come in and spend the just under 538 million. So we achieve that. And the other part is that we're not meant to hold any cash. So we're meant to spend everything and get it back down to zero. So that takes a lot of work from the finance team to achieve that. So that's really good. We mentioned there that we've invested a significant amount of our delegated budget into primary care. So the budget's kind of split in between what you have to do. So there's certain areas that you have to spend, and then you've got some flexibility around where you can do so. The challenge for Wigan is that our funding doesn't always follow the way that the borough is structured. So if you're a resident in the borough, you'll know that there's been significant amount of house building over the last couple of years, and that hasn't been reflected in our allocation. So we've got a growing population, and we've also got an ageing population, and with that comes more demand on our services. So it's been more of a challenge to balance around there. And what we've needed to do is to have a plan around looking at how we can use the money more efficiently and effectively, and that's all, and manage the tension between investment in primary care and GPs and secondary care in terms of the hospital and issues around there. But we've managed to achieve that with and maintain our admin budget, which is within its target of 7.1 million. So we move on to the next slide. Yeah, so this slide shows you how the budget or the spend is constructed. So as you'd imagine, there's quite a significant amount that's on the hospital contract, but also a sizable chunk in primary care. And so what we try and do, the balance is, as Craig set out earlier, and you can see through what my colleagues, the directors, talk about, is trying to take pressure off the hospital or to move care into where it's more sustainable and where it's more effective for our residents, so keeping people at home and keeping them healthy. So that's the balance between trying to invest in primary care to move costs out of the hospital. So no one wants to go to hospital, but equally your director of finance doesn't, because that's where it's most costly. But the healthiest place for people to be treated is at home, and that's what we try and maintain. So there's always a tension between where we'll spend the money, and what we try and do is try and move it into those other areas. And that's what the pie chart there is demonstrating. So we move on to the next slide, please. Yeah, so so this is just to tell you about the current position. So you won't get any kind of meeting with anyone in the health service or really in the public sector where they won't talk about how they've been affected by COVID. And for a CCG, what's happened is in the current year is the way that we're funded has changed. So because of the pandemic, we would, rather than having our allocation that I've just talked to you about there in 1920, we've moved to a position where we've been drawing down money each month. So we've had two kind of budgets, the one that would sustain the services that I've outlined there, and a second will be claimed for additional costs of COVID to cover us. So in terms of that's also been the council's claims as well, so we've overseen those, so around supplies of PPE and equipment to council employees and frontline staff there, but also some of the additional work that we've had to do as a CCG has been funded there. That's given us difficulties in terms of where I've talked about where you have a choice about where you move the money around, and thinking about what we wanted to do as a transformation plan. So that's caused us some difficulties there. From the second part of the year, we move into again a different phase with our money, where it comes into Greater Manchester as a whole and is redistributed through the CCGs. And we're just working through what that means for us in our financial position. I think what's really important to talk about there is that we have a pooled budget, so we pool with the council. And the idea around that is that we use the strength of both systems and both organisations in terms of trying to take activity out of the hospital and move that into the locality, and do a lot of preventative work and keep people healthy so that we can use our money more effectively. That becomes more and more important as we move into COVID and recovery, hopefully from the pandemic. So you should see more around this when we're talking to you next year, or if you look at any of the governing body meetings, you'll see that we're talking about transformation and joint investment there, and that's some of what we've used to get us to financial balance this year. Thanks. So if we go on to the next slide, so as I said, what that's meant for us, the change in the funding, is we'd had what you'd call a quick plan. So this is where we'd look at transformation programs or areas where we could use our money, use our services more effectively to allow us to balance. So generally, last year we achieved 15 million in terms of QIP. And because, as I said at the start, the way we're funded, we're always going to have to look at that, because growing population, ageing population, greater demands on services. So that is outstripping the growth that we're getting in terms of our finances. So we'd rely on a quick plan to help us balance, and that's been really difficult. But hopefully moving into the new regime, into the second half of the year, we can start to construct those. But one of the problems we've had there is that I talked about the hospital and the cost of the hospital. We had a contract that was based on activity, so we could control activity, we could control the costs there. That's moved to a block. So what that means is they just get a set amount and they've got to perform in that way. That limits the amount of money we could or efficiencies we could make through that contract. So we've just got to look at different ways about how we manage our resources, and that's where the pool with the council and the joint relationship that we have with the hospital in something that we call the Healthier Wigan Partnership, where the three organisations come together to try and commission and deliver services together, will help us through that. So we're looking at having a combined finance reporting for the locality as a whole, something that will be really important in this year and future years. It was the driver behind the pool budget and setting up the integrated care committee. So I think, have I got any more slides? Oh, I've got one more. Yeah, so I think I've probably covered this. So yeah, the solution, I mean, this is what we believe as a CCG. The solution to our problems isn't just working in isolation. We've got to work as a system. So with the hospital and the council to kind of drive out these efficiencies. And what we're doing is joining how we work in terms of our contracts and services to make sure that we're sustainable as an organisation in the medium term, but also really primarily to deliver the best services that we can within the finances that we've got. So as I say, what you should see, and if you look at the finance committee meetings and the governing body committee meetings, you'll see that there's a lot of work that's going on around how we deliver that more effectively as a locality. Okay, thanks. So just wait for questions now.
Thank you all. Excellent presentation and fantastic stewardship of our finances through very challenging times and choppy waters. I'm very biased, but one of the best CFOs we've got in Wigan here, so thank you very much. I was just going to pause, as Paul said, to see if there's any questions in the chat. Don't think there is. Jenny has reminded people, if you do want to ask any questions, please put them in the chat. I'll take a pause after the next few sections just to check on the chat and try and answer any questions if they come up. So, working with partners. As you can see, this is a time lapse for the Brimward, which is classed as the field hospital at WL, which was our development of additional capacity and wards at the latter part of the 1920 financial year. So should we just play the time lapse? Thanks again to the comms team. I think that gives you a good flavour, and it was really pleasing to see not much rain in Wigan over that time lapse, but a great development there by WWL. So here are just some key sort of achievements or things we would like to share with you with regards to the work of the partners. So fantastic relationships, I think, through the lens of the Healthier Wigan Partnership, and we are really accelerated the relationship development with the council, with Wrighton, Wigan and Lee NHS Foundation Trust, it's now a teaching trust, and our GP collaborative, and also our North West Boroughs colleagues. So I think that's really, really important. Urgent care. So Christopher Homes, we brought the urgent care treatment centre into Christopher Home. It was a really great collaboration for GPs and hospitals and CCGs to have a primary care centre for the borough. I don't know if people had visited, but it was one of the first places I did go on my visits last year, and it's absolutely fantastic. Again, primary care absolutely in the spotlight for many, many reasons last year, and continues to do so. But we established 7 primary care networks to match our 7 service delivery footprints, as well as supporting individual practices with technology and workforce. Really pleased that the sort of digital revolution hit primary care the way it did, and primary care really embraced the challenge and went forward and accelerated their digital offer. The establishment of the PCNs, you might think, is a bit of an easy sort of achievement, and actually there are lots of places across the country that didn't have PCNs mapped to neighbourhoods, so I think it's something that we're really proud of. Happy, healthy people, our single transformation plan in the borough. It's our refreshed locality plan as part of the Greater Manchester devolution, and also it is about our contribution to the Deal 2030, which talks about not just our pooling our finances but our resources and working closely with partners. If you've not had an opportunity to read Happy Healthy People, please do so. It was a fantastic collaboration and co-produced piece of work with real engagement from our partners, our citizens, our patients, our residents and all of our staff, and something we're extremely proud of. That was in the days when we could all go out and do engagement events face to face, which I'm sure we'll be able to do soon, but yeah, it's something that I personally miss anyway. And quality, it wouldn't be an AGM without mentioning quality. We did significant partner work on monitoring and measuring quality. The quality team under Sally Forshaw, our executive nurse, did a fantastic job, but quality isn't just the responsibility of that team, it's everybody's responsibility. And I think some of our quality measures, if you look at our performance reports, had really gone in the right direction and are good illustrative examples and evidence of our quality improvement in the borough for the 1920 period. Mental health, again, something we are extremely proud of for the development journey and improvement work that we've done with our mental health colleagues. This isn't just about Northwest boroughs, it's about the work with our other partners, with the council, with improving healthy lifestyles, with public health, and of course all of our third sector and voluntary sector. So mental health link workers in each of the 7 service delivery footprints, supporting our adults age 18 and over and working collaboratively with primary care and community link workers. Establishment of a mental health activation board, and something very close to my heart, combined support for our suicide prevention programme. Mental health and me, I know some of our GPs and clinical leads on the governing body have been real champions in promoting this, Dr. Jane Davis being one of them. So working with our children and young people, which has included some really accessible events, the running partnership with the borough and Wigan and Lee Youth Cabinet. The cabinet is absolutely fantastic and it is a real asset to the borough, so something again we're really proud of. And of course Wigan Pride, that was the first real digital event that we did at scale and pace, and it was absolutely fantastic. So for those who didn't watch it, I think you can still get it on our YouTube channel, but it was brilliant. The way in which the team managed it, but also everybody who participated in supporting it and all of the acts, considering we couldn't do it in person, it was an absolutely fantastic event. So well done to everybody who was involved in Wigan Pride. So continuing with our work with partners, and again, we couldn't allow this opportunity to pass without talking about some of the opportunities that have arisen through our response in relation to COVID-19. We know COVID-19 is an extremely difficult and challenging time for lots of people for many, many reasons. But with that has come some opportunities. So we identified and managed shielded and vulnerable patients. So this was about making sure that we got the medicines they need, that they were supported, and that we had enough stock for our PPE, which I think is some of the team have worked really, really hard on in partnership with the council, Tracy Smith and Joe Wilmot, to mention a few. The new location-based services in the form of hot clinics, again something primary care really embraced and delivered the hot clinics to manage COVID-19 patients safely. The COVID safe seal we put around our care homes to protect them, and we delivered a number of iPads in the borough so we could ensure that families keep in touch with loved ones. We knew it was a very challenging time, especially with the legislative changes with regards to visiting the care homes, but again something we wanted to do to try and make sure we keep people connected for their health and well-being. The care home works again that we've continued to do with regards to the resilience plan, the care home group. I know that there are a number of people that sit on that, and I'm not going to try and mention them all, but they've done a fantastic job at having a really robust, comprehensive, responsive resilience plan to our care homes. So during the first few months, the Ask My GP and the similar online consultation bookings took off at scale and pace, and couldn't be prouder really of how primary care, our GPs, our practice nurses and practice staff really embraced it, even though there was lots of anxieties about it, and rightly so. I think now, and as a user of Ask My GP, whether it be for consultations, whether it be acting on behalf of my nan, or whether it for my little boy and looking at the medication management, it's absolutely fantastic, really great responses, and for some of us it's going to be a preferred way of working for the future. That's not to say that we won't be doing face-to-face visits for GPs, but I think this is about offering a menu of opportunities for everyone in relation to access. And then the work the CCG did with the collaborative intermediate care to continue to provide our rehabilitation services. So the work we've done in relation to the work, as I said, across intermediate care and rehab. So GP-led community beds in Lee, another fantastic development led by Dr. Jen Wong in Lee that came out of our response to COVID. So it's just a collection really of some, I think, brilliant examples of our partnership work, and we probably could have done, as I said, a whole session on partnership work and the achievements and successes to date. So that's just a little flavour for everybody who's watching. And now I'm going to share with you a video that I think was also shared at our Wigan Pride event, a fantastic song from the NWAS choir.
Oh, go on then. Okay.
Are we good?
Oh my God, you smiled. It's amazing. We're good. Yeah, go.
I'm a one-way motorway.
I'm the one who drives away and follows you back home. I'm a streetlight shining. I'm a wild light burning bright, burning off alone.
It's times like these you learn to live again.
It's times like these you give again, again.
It's times like these we learn to love again. It's times like these, time and time again. faces. I'm glad to start. I'm divided. Do I feel wrong with leaving all behind? It's times like these you learn to live again. It's times like these you give and give again. It's times like these you learn to love again. It's times like these, time and time again. I'm a one-way boy. I'm the one that drives away, then follows you back home. I'm a street light shining. I'm a wild light blinding bright, burning off alone. It's times like these you learn to live again. It's times like these you give and give again. It's times like these you learn to love again. It's times like these, time and time again. It's times like these you learn to live again. And it's times like these you learn to love again.
Thanks for listening. Hope you enjoyed it. It was just a bit of a project for some of the staff at the North West Ambulance Service, something positive to focus on in these difficult times. If you did like it, please feel free to donate on the link below, Just Giving page. It's for the North West Ambulance Service charity, which is there to support its staff. Thank you very much and stay safe.
Wow, that song gets me every time. It was an absolutely fantastic song from NWAS, and please, again, if you are able to, feel free to donate to the charity. We have had a question before I hand over to Frank with regards to the voluntary sector from John at Age UK. What has the CCG been doing to support sustainable voluntary sector across Wigan? I think that's relevant to now as well as the 1920 position. I think in 1920, through our Healthier Wigan partnership, we had a real strong sense of ongoing support from the voluntary sector. Their engagement and involvement in the development of our locality plan was absolutely key and critical, and something that we wouldn't have been able to produce such an excellent transformation plan without the support from the voluntary sector. Clearly, we want to, through the Healthy Wigan Alliance, build our voluntary sector offer, so that links to our transformation plans, and they cut across children and young people services, they cut across mental health, for example, and the work that we have been doing more latterly in our activation board, which is the engine room of Healthy Wigan Partnership, again wants to make sure that the voluntary sector not only have a seat around the table, but help shape and develop and influence the future for the borough. We don't just see the voluntary sector as peripheral support services, they are integral into the work we do both in the CCG and the council. and we want to strengthen our relationship and offer, especially now we're going to be living with and recovering from COVID as we go forward. Always more to do though, however, the door is always open to our voluntary sector colleagues, and we want to have them work with us side by side and walk this journey together. So we can share with you some more of the details of the list of things we've done to support the voluntary sector, but for now, hopefully that's enough to initially answer the question in the chat. So I'm going to now hand over to Frank Costello, our Deputy Chair, who's done a fantastic job with the engagement team in relation to public and patient involvement. So over to you, Frank.
Hi. Thank you very much for that introduction, Craig. As Craig mentioned, I'm a lay member with responsibility for patient and public engagement, also the Deputy Chair of the CCG. Essentially that divides into two parts, but they are linked. The primary purpose being to ensure that in exercising its decisions, the board is always conscious of the needs of the patient and that it has concerns for its patient in everything it does. That may sound a little bit daunting, but it's anything but, because I'm fortunate to have here a board and an organisation that is very much switched on to placing the patient at the centre of its decision making. And I'm privileged in a way to be able to demonstrate that through patient involvement there is real influence, and it's worthwhile for patients to be involved with us in our work because they can see some positive outcomes at the end of the process. There's a slide here that in a way demonstrates that. It's rather busy and it captures perhaps NHS jargon, and if I can perhaps simplify it for you, what it's demonstrating is that in exercising our commissioning decisions, i.e. deciding to buy services, we place the patient in that decision-making process with us. So we will talk to them at the outset about services, about what they want to see from those services. We'll engage with them in designing services. We'll equally use patients and their expertise to help us to decide tenders, to evaluate tenders and introducing new services. Furthermore, there'll be an involvement in actually monitoring service delivery and ensuring that it's meeting its objectives, so that we end up with what's termed a virtuous circle, that services are efficient, they're effective, they're accessible, but more particularly, they're meeting the needs of the patients. We were particularly delighted in the last year to see our work acknowledged by NHS England as outstanding, and that doesn't come easily. It's something we worked hard to attain, and there's a small team here at the CCG that works tirelessly to ensure that we are not only meeting our objectives, but also we are giving real meaning to involving our patients. With some big engagement projects during the year, we've already heard reference to the digital online service, and before that was introduced, we actually spoke to patients and said, what are your expectations from it? What are your concerns? And in particular, are there any barriers there that we need to address before its introduction? Always mindful of the different talents of patients. Some will be very much IT enabled, some not so. Some will simply not be able to use IT. So we need to ensure that our services are accessible to all our patients, irrespective of their particular needs and characteristics. We've also had reference to our quality framework, and it's particularly pleasing that through the work of the quality team, particularly within primary care, all but one of our 59 practices are either good or outstanding, and the remaining one is one that we've taken action about at the moment. We have a caretaker GP in place, and we're out to procurement, and we will make a decision on a new provider in time for that service to come on stream from the 1st of April next year. And again, patients will be part of that decision-making process. We've also been very much involved with the locality plan, which Craig has described, our focus for the next 5 years, making sure that services are accessible to the community and provided in perhaps a different way than has been the tradition, because we can harness technology to make services much more accessible, more economic, with better outcomes for our patient community. And we've had much more working with our partners and the voluntary sector. One such one being the Maternity Voices Partnership, which was a relatively informal group that met, I think, every quarter and looked at provision of maternity services and how we might improve them. And through that came issues such as continuing support for feeding, and concerns in that regard led to the establishment of the infant feeding team. There was also a development beneficial locally through the local tongue-tie service, whereas previously people had to go to Manchester to access that. We're now able to provide that locally. And equally, there was concern about continuity of care, and having listened to those concerns, there's now much more emphasis on one midwife staying with an impending mother through their confinement and delivery period. So we can demonstrate real benefits from that involvement. I think looking, oh sorry, I gather there's a video to describe that. Yeah.
Hi, my name is Linda. I'm one of the dietitians in the Specialist Weight Management Service. As part of that service, we run a maternity weight management service called Happy Mum Healthy Bump, which is part of the Lose Weight Feel Great programme. For us, we've been attending the Maternity Voices Partnership meetings regularly and find it's a great opportunity to link in with other services and to stay up to date with what's happening in the borough, which helps us with signposting women to various supports that's going to support them during their pregnancy. This last year we had the opportunity to actually attend one of the meetings and give a presentation about our service. As a result of that meeting, we were actually able to link in with the community matron Anne-Marie Goodall and arrange a meeting to review our referral pathway. As a result of this taking place, we've actually noticed an increase in our referrals. And moving forward, this is something we're going to continue to work on and expand to get the word out there regarding weight management support during pregnancy and what's available to women within the Wigan Borough. Thank you.
Okay, thanks very much for that. In terms of looking forward in the agenda before us, clearly COVID has changed the way we need to do things. And one of our challenges will be ensuring that in going forward we're able to touch base with perhaps those from the seldom heard groups who wouldn't normally come forward with their concerns. We need to be searching them out and finding what their issues are so that we can actually provide equality of provision to all our community. We also need to understand and resolve the impact that COVID has had on other vital services within the community, and we're working exceedingly hard at the moment to restore those essential services, and certainly you've read about national concerns in that regard, but certainly at a local level we're very much into how we can quickly recover that and ensure that needs are met irrespective of the COVID situation, and how we can effectively manage those services going forward in the knowledge that COVID is certainly with us for the time being and perhaps into the future. And finally, in terms of mental health services, Craig did allude to this, and that we are working with local people at the moment to enhance those services and perhaps develop for Wigan bespoke services that perhaps better reflect the needs of the Wigan locality, and we will ensure that in that development the local voice is heard. And returning to my opening point, it's great to be able to work with residents, to listen to their concerns, to listen to their aspirations, and to be able to influence those in the way that the CCG operates. And for all those that have contributed, could I extend a great vote of thanks, because without those patient advocates we wouldn't be able to achieve what we do. So thank you. Right, we now have from our Health Watch colleagues a short video describing some of their work.
Lynn, Chair of Wigan Lee Health Watch. We're very pleased with our association with the CCG. We work well together, and one of our objectives for this year was to get a much closer relationship with the major players in the town. Thank you.
Hiya, I'm Karen Parker, I'm the Chief Officer for Health Watch Wigan and Lee. I'd just like to say a big thank you to the team at the CCG, the commissioning team, but most of all I'd like to thank Alexia and Rachel for their commitment to working in partnership with us as a Health Watch and making our role easier. There's a clear commitment and dedication towards patient involvement and engagement from our Wigan CCG. And that's evident because they were recently awarded outstanding in an NHS England assessment against the way that they work with involving patients. I hope that our relationship continues and that we continue to work really well together in the way that we're currently doing. Thank you.
Okay, so thank you, Frank. Excellent overview as always. Just on that last point, so unfortunately we're not able to share with you, as they've not been published yet nationally, the 1920 CCG's ratings. We normally try to do it and coincide it with our AGM, so we have made a resubmission for our rating, and as soon as that is published on the NHS England website, we will ensure that we share that with everybody, as that gives the CCG's rating across the board, but also in relation to some of the key statutory requirements, financial duties, etc. So just before I do thank yous, I just want to hand over to Dr. Tim Dalton, who is chair of the CCG.
Yeah, so thank you, Craig. Really, hopefully what we've done today for our annual general meeting in a very different and unusual way is exemplify why we have clinical commissioning groups. The purpose of commissioning groups was to empower clinicians and their patients to talk to each other, to focus on what's important, to drive the activity of the health and care system around them. Locally, we've taken that a step further by making sure that the clinicians and the patients interact far more effectively with the officers and the structures of the CCG, but then also building it beyond health into the providers and into the broader reaches of health and care with people like the council and so forth. What this gives is a much more intuitive and informed set of commissioning decisions that are not therefore dry and academic, but actually deliver care in a meaningful way to give the patients and the public what they want and they need to not only help them when they're poorly, but to also keep them healthy for much longer and much better ways. And so I hope today has been an insightful view of that world, how we're changing and evolving it. And I would hope we'll have some good news about our ratings when those are published in due course. So thank you for your time today.